Hello, my name is Kenyatta Stevens, and I'm a student at Columbus State University, as well as a registered nurse at Grady Memorial Hospital. I've invited you here today to discuss a need for change in the critical care units, ICU, and intermediate step downs. Recently, there have been an increase in the incidences of CLABSIs, which are central line associated bloodstream infections. I noticed the increase has been happening frequently. In order for us to decrease those incidents happening in our patients, there has to be some changes made. And here's just a picture showing what a Clabsi or central line is, and here is what is the infected catheters, what we are seeing within our patients. So this project is just to bring awareness to the staff, administration, and managers that we do have a problem on our units with CLABSIs. Our patients are suffering from death, morbidity, and our hospital is suffering from an increase in cost. So it is my intentions to provide research information that has proven that there are steps that we can take to decrease these incidences. So, what is the CLABSI? As stated earlier, CLABSIs are central line associated bloodstream infections, and they are confirmed by the laboratory that happens in CVC insertions, and that is central venous catheters. According to the California Department of Public Health, CLABSIs occur within 48 hours of having a CVC inserted. There are approximately 30,000 CLABSI that happens each year in critical care, and that's including the 40% decrease that has happened between the years of 2008 and 2013. CLABSIs are causing patients to have prolonged stays in the hospital. They are causing the healthcare system to pay out more money, which causes Medicare not to reimburse the hospitals for these types of infections. They can be prevented, if we use proper insertion techniques and maintenance with the CVCs. So today I'm going to discuss proven and successful methods that are occurring in other facilities that we should take on in this facility to decrease the incidences in our patients. So CLABSIs can result in negative patient outcomes, and that's sometimes death can occur. With cost, we spend approximately $40,000 for each occurrence. So for every patient that has a CLABSI, that's $40,000 paid by the healthcare system. As stated before, when there's a patient who has Medicare or Medicaid, the Medicare insurance does not reimburse the hospital, so the hospital is ultimately responsible for that cost. Some signs and symptoms that we see in our patient that is having a CLABSI is fever, chills, increased heart rate. So you may notice that your patient is tachycardic. At the insertion site, there may be tenderness, redness, and swelling. And you may also see some drainage, maybe post-drainage from that site. And here's a picture where there's an infection going on at the insertion site of a patient. So, our objectives for this presentation is to make sure that everyone is aware of what's happening in the critical care units. I want to make sure the staff is fully educated about the need for change, so they would know why this change needs to occur and why something needs to be implemented to make sure that we're taking care of our patients. Um, it would be good for us to have a standard protocol, and that could definitely decrease our CLABSI rates, and there have been evidence-based practice with proven and successful methods that would allow us to decrease those rates. So the rationale for CLABSI prevention. The incidences of CLABSIs are occurring more frequently on the CCUs, the critical care units. Patients must be protected from acquiring those bloodstream infections, and that starts with us. Most patients have one or more CVCs inserted, which is an increased risk for acquiring the bloodstream infections. And although CLABSIs can occur anywhere in an acute facility, they are mainly known for being acquired in the emergency department and on the critical care units. So that's kind of important for us because we are a critical care unit. Staff members must avoid treating central lines like peripheral IVs. You know, the usual, just making sure the site isn't infiltrated or making sure the site is clean. It takes a little more than that with central lines, and we must be educated on the methods of cleaning CVC because it's a little more difficult. So let's talk about needed change. We know that we have seen increased rates on the unit in CLABSIs. So we need to have extensive education for every staff member. You know, no one is excluded. They need to know what needs to be done within the patient when we're caring for those CVCs. We should also have a development of a team of nurses that can go to each critical care unit to check to see if the proper maintenance is done, to make sure that the dressings are changed when they're supposed to. And we should also implement a CVC bundles. And all of these are proven methods that has worked for other facilities. And I think it would work well for our facility as well. So here's the question that I'm presenting and I've researched. How do methods such as increasing education on CLABSIs, prevention and use of central venous catheter bundles, proper hygiene, and proper maintenance reduce the incidences of CLABSIs compared to current limited prevention measures? So, one of the things that I researched was proper hand hygiene. We must make sure that our hands are clean, our patient hands are clean, because we are dealing with those CVCs a lot, whether it's inserting medications or giving blood products or feedings as in parenteral nutrition. So, according to the research, using soap and water definitely should occur, and we should also use the 2% CHG wipes 3 times a day. That should happen with our patients. You know, the patient's hands should definitely be clean, and that can decrease CLABSIs. And CHG wipes, they provide continuous killing of bacteria for up to 6 hours. So if you're working 12-hour shift and you clean your hands once at the beginning of the shift and then in the middle of the shift, you've covered yourself for clean hands. Every nurse must be trained to demonstrate proper hand hygiene, and they need to know how to wash your hands. You know, you just go in and you wash your hands and you think you've got all the germs off, but actually germs can still be left on your hands. So using soap and water and then going behind it with CHG wipes is definitely a protocol that we can utilize here. Our nurses should be monitored on the protocol. You should be washing your hands when you're entering your patient's room and also when you're leaving your patient room, because you leave one patient room, you have to go into another patient's room. So you want to cut down on those germs. The quality improvement protocol shows a decrease in Clabsi rates. So this was something that I figured would definitely decrease our rates of Clabsies. It is a proven and successful method that has been researched, and it shows a really decrease in rates of Clabsies. And according to one of the researched articles, this is just a chart showing before they introduced the proper hand hygiene protocol, and that was in the year 2009 to the year 2010. You can kind of see how they had a lot of Clabsies. And then 2011 to 2012, during the protocol, you notice there are little spikes in Clabsies. So this is the number of Clabsies per 1,000 catheter days, and it's 0. It's along the line of a 0. So that shows us that proper hand hygiene is a good method to implement. Another method that was also proven successful is the CVC insertion bundles. And with that, you want to make sure that you're using alcohol-based caps on the hub of every lumen when they're not being used. You want to make sure that your patient has the chlorhexidine gluconate dressing at the insertion site. And as stated before, we want to kind of have a team of nurses that goes around and check our patients that has those CVCs in place. Yes, as nurses on the floor, we have to also make sure that our CVCs are properly maintained and that they are cleaned and our dressings are okay. But if we have that extra team to kind of come and check the units, at least whenever they're needed or whenever they're called, then that's kind of like an extra backup for us. And then everybody is working together to make sure our patient does not acquire a bloodstream infection due to having a CVC inserted. So on the bundle checklist, you have the CVC dressing should be intact and 100% occluded. So you don't want anything able to seep underneath that dressing. It needs to be air sealed tight. The date of the insertion should be written on the dressing, so you'll know when to change it, when it was placed, and the initials of the nurse should be on the dressing. Now the dressing should be changed within 7 days if it's a transparent dressing or that gluconate dressing. But if you have a gauze dressing, then you want to change it within 48 hours. Daily assessment should be performed at the insertion site. You want to make sure that there is no signs of infection, no swelling, no tenderness, no redness. So you want to make sure you check that, and as the nurse on the floor, it's being checked, and with those team of nurses, it's also being checked. So that's like twice that it's being checked, and that could be very good for the patient. Again, you want to make sure that you're using alcohol-based caps on the hub of the lumens when they're not being used. You don't want to introduce any bacteria on that external surface that could enter the lumens and end up in the bloodstream. You want to make sure there's a bio patch or a chlorhexidine sponge at the insertion site to make sure that area stays clean. So here's a graph of the CVC bundle, and here's the side of before the bundle, and you can kind of see they was definitely at an increased rates of Clabsies. And then here on this side, which was August to September of part of 2012 to 2013, there's a significant decrease in CLABSIs, all by just using those that bundle checklist that I just discussed. So with this central catheter team, and it's just like I said, a team of nurses that kind of goes around and check all of our patients that has had a CVC inserted. Those nurses must participate in training webinars during 3 phases of implementing this new protocol. They must complete online quizzes, and they must show competency of CVC maintenance. So it's not just like taking a 1-hour class. You know, there has to be extensive education. So these webinars and taking quizzes and doing checkoffs to make sure that they have it kind of make sure our nurses are capable of doing what they're supposed to do when they're needed. So my recommendations for change so that we can decrease our rates on the floor are simply to discuss it with the managers and the hospital administration, because it has to be approved. And anytime you're changing something at a local level, it needs to be accomplished by using basic policies and education that has deemed successful. And I have done research and I have gathered successful methods that could definitely be good to implement at our facility. Once we got approval from the managers and the hospital administration, and we have gotten extensive education throughout the staff, then that's the next step of getting the implementation of the new protocol. So remember, with this protocol, the staff members will go through the extensive education, periodic testing, checkoffs at the end of each course that is taken. And in order to maintain the protocol, our nurses must show competency. Developing a central catheter would be a catheter team would be my big recommendation, because we need all the help that we can get. And I know that things get really busy and you're pulled here and you're pulled there, so having that extra team to kind of follow up behind us would definitely be a great help, and everybody benefits. We as the staff benefit, the hospital benefit because of decreased costs, but most of all, our patients benefit from it because they have positive outcomes. We decrease morbidity, we decrease mortality, and the healthcare cost is decreased. So you never know, when there's the hospital not spending so much money, maybe there's incentive for the staff. So in evaluating this change, we must we have to see what the CLABSIs are during every quarter, and then we have to compare it to what they are after the implementation, so you can kind of see if it works and if it doesn't work. Data must be collected and analyzed and compared. So it's a lot, but I really think that it helps the facility. With the central line team, data will also be collected on the number of times that they were used and the number of times that they were called to come to the floor to check our patient's line, and that will be monitored so we can kind of compare how it is without them and then how it is when we actually implement the protocol. The success of the team may be evaluated by examining the percentage of the correct maintenance of centralizing. That all comes in with documentation. So documentation would be audited. So you want to make sure that you're documenting correctly on your maintenance and on your insertion sites. So, you know, that's kind of the only way that we can kind of see if this works. So our expected outcomes. So if the implementation of this protocol takes place and it happens, we want to. I expect the staff to be very educated on the subject, to know what it is that we need to do to decrease these incidences of CLABSIs on the unit. There should be a reduction in CLABSIs, so we should be able to see a difference in what there is now and what it would be after implementing the protocol. And for the hospital, we should see a decrease in cost. So that $40,000 that been spent for every CLABSI that occurs, we should see a decrease if we implement this protocol. So, in conclusion, CLABSI rates has tremendously increased. And we want to do something that increases positive patient outcomes. And implementing this method would be a benefit for us all, for the staff, for administration, for the hospital. Everybody benefits, everybody wins. And the patient can go home in a timely manner, no prolonged stays. So implementing this, educating the staff, everybody wins. So that concludes my presentation. I hope everybody learned something today. I hope everybody was able to take in some good things. And if you have any questions, I can answer them to the best of my ability. And thank you for joining me for this presentation.